The 7 ingredients of the complete consultation. There are 7 important ingredients that make up the complete consultation, and these require perfect practice every time you treat someone. The more we say or do something, the more confident we become at saying and doing that action. We take on a sense of leadership, reliability, structure, and foundation of knowledge in what we are doing and saying. The practitioner also appears more confident to patients. Patients are more likely to believe and then trust that practitioner if the manner in which an action is performed or explained is reliable, structured, ordered, and is based on a foundation of knowledge. Just like you have individual mini-systems for examining a knee joint or assessing someone's spine, the whole new patient consultation becomes a parent system made up of mini-systems. And this becomes your system. So let's get started. 7 steps to the complete consultation. Step 1. The receptionist welcome script. Step 2. The welcome pack. Step 3. The practitioner's welcome script. Step 4. The treatment room. Step 5. The consultation. Step 6. That final touch. Step 7. Perfect practice. Step 1. Greeting your patient. The receptionist welcome script. The first step of the complete consultation begins before you even meet your patient. Before you meet and greet your patient, your receptionist will be the first point of contact other than the patient's phone call to make their appointment. The receptionist's greeting is just as important, if not more important than your own. So you need to ensure that your receptionists are trained to greet your patients in a way that you want. Receptionists have different amounts of experience and training. Your receptionist may be new to this type of work, new to your clinic but with experience, or may have been working in your clinic for a number of years. There's no standard training requirement when it comes to receptionist training, let alone how to greet a patient. It's really up to you or the clinic owner as to how the receptionist is trained to greet your patients. Naturally, your receptionist should provide every patient with great customer service, which begins with a warm and friendly greeting. But what does that really mean? How do we make a greeting a memorable one, so that every patient who comes through your clinic door feels comfortable and at ease every time? New patients. Firstly, make sure that as soon as the new patient walks in through your front door, the receptionist stops whatever they're doing, stands up and smiles to greet the patient. Hello, you must be Mr. Richards. Welcome to the Sports and Spinal Group. The patient will immediately appreciate they've been noticed and acknowledged. They will feel special and important straight away. This may seem a little over the top, to stop and stand up, but when was the last time anyone greeted you like that when you last went to your doctor? This action immediately sends a message to the new patient. You're a valued customer to our business. You're important, and we want to ensure you feel welcome. The full script depends on the circumstances at hand, but the essential, no excuses message that must be relayed is, Hello, you must be Mr. Richards. Welcome to the Sports and Spinal Group. Now you may be thinking, what if the receptionist is on the phone or talking to another patient at the desk? Of course, these are situations where we need to adapt our script. The main point here, though, is that even if your receptionist is on the phone or talking to another patient, they must try their best to acknowledge and give priority to the new patient who's just walked through the door. They might need to put another person on hold or briefly excuse themselves from speaking with another person at the desk. This is an art and skill in itself, and only comes from prior training, understanding and experience of interactive situations when dealing with customers. Of course, a friendly greeting and great customer service also applies to any returning patient, but their greeting will be a slightly more familiar one. A cardinal sin that every staff member needs to be aware of, not just your receptionists, is thinking that their conversation is more important than acknowledging the arrival of a patient to the clinic. Have you ever walked into a store where two assistants are talking behind the counter that you're approaching? You're about to ask a question, perhaps you're about to ask for directions or actually buy something. Doesn't it drive you crazy when the assistants continue talking to each other even though you're obviously wanting to ask a question? They continue until they've finished their sentence or listen to the reply of the other. That's all it takes to make you, the customer, feel like they couldn't care less about you or the business they work in. We all need to remember we might be professionals in our own right, but in the end, we're in sales first and therapy second. We're not immune to the common customer service standards of any business. Step 2. The welcome pack. New patients should be asked to attend 5 to 10 minutes earlier than their scheduled appointment time so that they can complete the forms in the welcome pack before going into the treatment room. After welcoming the new patient to the clinic, the receptionist then asks them to have a seat. She then explains the welcome pack. The welcome pack contains all the paperwork your new patient needs to complete before you meet them. The welcome pack may contain a patient detail form, medical history record, consent form, flyers offering other services, special offers available within the clinic. Completing these forms in the waiting room saves you a lot of time when taking a patient's case history. You get a good idea about your patient and their health from their written responses prior to the consultation, leaving you time to ask more detailed questions in the treatment room. After explaining the contents of the welcome pack, the receptionist will close by asking the patient if they would like a glass of water and let them know where the bathroom is. Not only is this little touch a great way to complete the interaction between the reception staff and the patient, but it's also a healthy preparation for their treatment. Welcome packs are also a great way of introducing all the services that your new patient didn't come in for but may be interested in the future. A sample of welcome pack forms are included as part of this program. Step 3. The practitioner's welcome script. Now we come to your greeting. Your greeting is a matter of individual style and circumstances, but it needs to contain 3 critical elements, whatever the situation. Essential element number 1. Always tell the patient your name. This may seem pretty obvious, but how many times have you been to a practitioner, they call out your name in the waiting room from a distance and never introduce themselves? This conveys a subtle element of arrogance which can be so easily avoided. One of the most important personality traits of a successful practitioner is humility. Here are a few introductions you may choose to use. Hi Kathy, I'm Jeff. Welcome to our clinic. I'll be looking after you today. Sue? Hi, I'm Robert. Welcome to the clinic. I'm one of the physios and I'll be looking after you today. Hi, you must be Keith. I'm Peter, one of the chiros here. Welcome to the clinic. I'll be looking after you today. In every one of these examples, the patient will feel an immediate point of difference from anywhere else they've been to before. They will feel looked after before you've even started treating them. Trust levels begin to rise before you've even entered the treatment room. When greeting the patient, walk towards them first. Avoid calling out their name from the other end of the waiting room. Show them respect by approaching them so that they feel important and welcomed, about the same distance you would stand if you were about to shake their hand. Essential element 2. Make good eye contact and smile. These elements are vital, especially when meeting your patient for the very first time. Instant eye contact shows that you are switched on and interested in them. They need to see you smile in order to make a connection. So don't forget this important gesture. even if they are the last patient of the day. And a very important rule to remember here: how many times have you walked past a patient sitting in the waiting room on your way to the reception area and not said a word to them? Even if they are not your patient, never walk past anyone in your clinic without acknowledging them in some way, a smile or a hello. Patients appreciate being associated with a group of practitioners who hold the same principles of genuine care for all, not just their own patients. Essential element 3. Body language. Too often students walk up to a patient looking scared and worried. This is often due to inexperience. Your body language is a non-verbal signal affirming that you're in control, you know what you're doing, and you're going to help your patient. You need to project confidence and self-esteem without being fake or unnatural. Look at the manner in which you walk up to the new patient, the speed at which you walk towards them, the posture you hold, and the tone of your address to them. Your posture should be neither too strong that it's overpowering, nor too weak where your shoulders are dropped. Head is looking down, giving an impression of poor self-confidence. Walk too slowly towards the patient. This gives the impression you have all the time in the world, and you have nothing else to do all day. Walk too quickly. This gives the uncomfortable impression that you're in a hurry. You need to walk at a pace to indicate that you've been busy all day, but you're not rushing in order to finish your day. Practice your body language with someone who will tell you the truth about you and what you're trying to achieve. With almost all of this advice and information, role play is essential element 3. Body language. Too often students walk up to a patient looking scared and worried. This is often due to inexperience. Your body language is a non-verbal signal affirming that you're in control, you know what you're doing, and you're going to help your patient. You need to project confidence and self-esteem without being fake or unnatural. Look at the manner in which you walk up to the new patient, the speed at which you walk towards them, the posture you hold, and the tone of your address to them. Your posture should be neither too strong that it's overpowering, nor too weak where your shoulders are dropped. Head is looking down, giving an impression of poor self-confidence. Walk too slowly towards the patient. This gives the impression you have all the time in the world, and you have nothing else to do all day. Walk too quickly. This gives the uncomfortable impression that you're in a hurry. You need to walk at a pace to indicate that you've been busy all day, but you're not rushing in order to finish your day. Practice your body language with someone who will tell you the truth about you and what you're trying to achieve. With almost all of this advice and information, role play is by far the best way to practice. After all, you know what they say: practice makes. Remember, the most unique way you do or say things to your customers, the more that differentiates you from the pack. It raises you from the level of mediocrity to a level of excellence. So there you have it, your patient greeting. What a great start! A personalized greeting, a smile, eye contact, and great body language. Now let's lead your patient into the treatment room. That's right, you lead the way.